No one test can diagnose dementia. We make the diagnosis based on taking a really detailed medical history, a thorough physical exam, doing specialised thinking tests, and other tests like blood tests and brain scans, for example.
My name's Eleanor Curran. I'm an older adult psychiatrist at the Royal Melbourne Hospital. For people to have a diagnosis of dementia, the changes in their cognition need to be significant enough that they impact their day-to-day function. It's really important to try and see a doctor and have a diagnosis of dementia made. There have been some exciting advances in treatments for dementia, but for most people who live with dementia, at this stage we don't have treatments that can clearly cure dementia in the way that we think about with other conditions. But by seeing a doctor early and having a diagnosis made early, there are lots of different types of supports that can be provided and interventions and treatments that people can have access to that can really help people to live well with dementia.
We don't fully understand why some people develop dementia and other people don't. And it's likely to be some combination of increasing age, genetics, and poor cardiovascular health, for example. What we do know is that a buildup of toxic proteins is common to several forms of dementia.
Many of the treatments, which remain unfortunately in the research domain at the moment, are aimed at trying to get rid of these proteins. It's probably been most commonly attempted in Alzheimer's disease, where more recent treatments, which have been potentially promising, include making antibodies against these proteins to get rid of them.
For some people who are living with dementia, there are some medication treatments that we can prescribe that can temporarily help a lot of people with some of the symptoms of dementia, and that includes some of the cognitive symptoms, as I talked about before, like memory, but also some of the psychological and behavioural symptoms in some cases.
For now, there's no cure for any of the diseases that cause dementia, and there's no 100% certain way of preventing it either. The best way to reduce your risk of dementia are by staying mentally and physically active, eating well, and avoiding excessive alcohol, smoking, and head injuries.
We know certainly in people who already have dementia, so people with Alzheimer's disease, there's very good evidence that regular exercise and attending to those risk factors helps sort of delay the onset and delay the progression of dementia.
If we don't address those symptoms and some of the triggers that contribute to those symptoms, unfortunately those symptoms, those behavioural and psychological changes are associated with worse outcomes for the person who's living with dementia and for their families and other carers supporting them. And that includes things like potentially needing to move to residential aged care, distress for the person themselves and for their family members. Sometimes that ends up meaning that those people are prescribed psychotropic medications that can have significant side effects, and they can even contribute to things like falls and sometimes the really bad outcomes like physical aggression, for example. However, if we're able to understand why those symptoms are occurring for that person at that point in time, what factors might be triggering them or exacerbating them, and do something about those factors, we're often able to prevent those adverse consequences.
It's really important to remember that not all thinking problems and memory trouble is due to dementia. It's pretty normal to occasionally forget names or to lose your car keys or to have a word on the tip of your tongue. It's also important to remember that other things like depression, mood disorders, medication side effects, other medical conditions like thyroid dysfunction, vitamin deficiencies, they can also affect the way that you think. So I want to emphasise that if you are concerned about your thinking and changes in it, it's really important to speak to your doctor about it so that you can receive an accurate diagnosis.